Did you know that pancreatic cancer kills more seniors every year than colon cancer? Yet most people over 60 have never once been warned about its early signs. And here's what makes this even more dangerous. The symptoms show up months before this cancer becomes untreatable. Months. They are happening inside people right now who are sitting in their living rooms thinking they just need more sleep, or their back is acting up again, or their stomach has been off lately. Right now, as you watch this, there is a 75% chance you have already noticed at least one of these 8 symptoms and dismissed it as something else entirely. I'm Dr. William, and what I'm about to show you in the next few minutes is something most seniors will never hear from their own doctor, because here is the truth nobody tells you. Pancreatic cancer does not have an 11% survival rate because it cannot be treated. It has an 11% survival rate because it gets caught too late every single time. Stay with me through all 8 of these symptoms, especially symptom 5. That one has never once been on any list any doctor has ever handed a senior patient, but it should have been first. Everything else I show you today is building toward that one. Now, before we get into the symptoms, I need you to understand one thing about why this disease is so dangerous, specifically for seniors. Your pancreas cannot be felt from the outside. Your doctor cannot examine it in a routine checkup. And your annual blood work will not find this cancer until it has already spread. That is not a flaw in the system. That is exactly why this disease wins so consistently. It hides inside the same symptoms you have been calling aging for years. Here are the 8 signals it leaves behind while it is still beatable. Pay attention to every single one. Most seniors who notice dark urine do one thing. They drink more water. The urine lightens up for a day. They assume the problem is solved and they move on. That assumption is exactly what costs people their lives with this disease. Here is what is actually happening inside your body. Your pancreas sits directly next to a tube called the bile duct. This tube carries a substance called bilirubin from your liver into your intestines. Bilirubin is what gives your urine its normal pale yellow color and your stool its normal brown color. When a tumor grows in the part of the pancreas called the head, it pushes directly against this bile duct. It compresses it. It blocks it. And when that happens, bilirubin cannot flow where it is supposed to go. So it backs up. It floods into your bloodstream, and your kidneys start desperately trying to flush it out through your urine. The result is urine that turns dark yellow, sometimes brown, sometimes the color of strong tea or cola. And here is the critical detail that separates this from simple dehydration. It comes back. You drink water, it lightens. Then the next day, it is dark again because the blockage is still there. The tumor is still there. Water does not fix a tumor. This symptom appears before almost every other visible sign of this disease, and most seniors dismiss it at least 3 or 4 times before they mention it to anyone. If your urine has been cycling between dark and normal for more than 2 weeks, regardless of how much water you are drinking, that is not a hydration problem. That is a conversation you need to have with your doctor this week, not next month, this week. Now, you know what dark urine is actually telling you, and that knowledge alone could change what happens at your next appointment. But the next symptom is more dangerous than this one, because your doctor has already seen it in you, already given it a name, and that name is completely wrong. Your doctor called it arthritis, a pulled muscle, an old injury acting up, acid reflux, sometimes all 4 at once. And while you were treating the wrong thing, this disease was buying itself more time. Here is how to know the difference. Pancreatic cancer pain has a very specific signature. It starts as a dull, persistent ache in the upper part of your abdomen, not your lower belly, not your sides, your upper abdomen, right below your breastbone or slightly to the left. And it does not stay there. It travels. It wraps around your midsection and settles into your middle back, creating what patients describe as a band being tightened across their torso. This happens because your pancreas is surrounded by one of the densest networks of nerves in your entire body. When a tumor grows, it presses into those nerves. It invades the surrounding tissue, and those nerves send pain signals that radiate outward in every direction. Now, here are the 3 specific details that separate this pain from regular back pain. First, it gets significantly worse after you eat a meal. Not immediately, but within 30 to 60 minutes of eating, the pain intensifies. Second, it gets worse when you lie flat on your back. Many seniors with this symptom find themselves sleeping in a recliner or propped up on multiple pillows without fully understanding why lying flat makes the pain unbearable. Third, it does not respond the way normal pain responds. You take ibuprofen, you use a heating pad, you rest, and the pain comes back exactly the same way every single time because you are treating the symptom, not the cause. If this pain pattern sounds familiar to you right now, you need to stop assuming it is your back. Tell your doctor the pain is in your upper abdomen and radiates to your back, and that it worsens after meals and when lying flat. Those 4 details together completely change the direction of your diagnosis. That distinction between pancreatic pain and regular back pain is something most seniors spend months figuring out on their own. Now you have it in 60 seconds. But the third symptom is worse than both of these combined because this one is not just being ignored. It is actively starving your body right now, and you are sitting at your dinner table every night watching it happen without knowing what it means. You sat down to eat, 3 bites in, and you were done. You pushed the plate away and told yourself your appetite is just not what it used to be. That is not your appetite changing. That is a tumor pressing against your stomach from the outside, physically compressing it, and your doctor has no idea it is happening because you never mentioned it. Almost nobody connects this to cancer. Not seniors, not their families, sometimes not even their doctors. When a pancreatic tumor grows, it expands beyond the pancreas. It pushes against the surrounding organs, and your stomach sits directly in front of your pancreas. When a tumor presses against it from behind, it physically compresses it. It reduces its capacity, making it fill up with just a fraction of the food it normally holds. At the same time, the tumor is disrupting your pancreas's ability to produce digestive enzymes. Without those enzymes, food sits in your stomach undigested far longer than it should. Your stomach stays full. Your brain gets a signal that you are not hungry, and you stop eating. When you stop eating because you feel full after 3 bites, you start losing weight without trying. That weight loss accelerates quickly because your body is also not absorbing the nutrients from the little food you do eat. Unintentional weight loss of more than 5% of your body weight over 2 to 3 months is one of the most serious warning signs in all of medicine. If you have lost 10 or 15 pounds without changing your diet, that is not a blessing. That is a red flag. Now you understand why 3 bites and done is never just an appetite problem. That single piece of information could be the difference between catching this at stage 1 or stage 4 for someone watching this right now. And I want to tell you something before we go further. In over 20 years of treating patients, I have seen one symptom appear in nearly every single advanced stage case I have ever treated. Every one of those patients had it. Everyone ignored it. I'm going to show you exactly what it is before this video ends. But first, the next 4 symptoms are what make everything make complete sense. And the 4th one is already visible right now on your body or someone you love. Jaundice is what happens when bilirubin backs up so significantly in your bloodstream that it begins depositing in your tissues. Your skin takes on a yellowish tint. The whites of your eyes turn yellow. In seniors with darker skin tones, it shows most clearly in the eyes and in the palms of the hands. But there is another part of this that almost nobody warns you about. Intense itching all over your body with no rash, no explanation, and no relief from lotion or antihistamines. This happens because bilirubin depositing in your skin irritates the nerve endings directly. It is relentless, and it does not stop until the underlying cause is treated. Now, here is the dangerous part about jaundice, specifically in seniors. It looks identical to jaundice caused by gallstones. Same yellowing, same dark urine, same itching. And because gallstones are extremely common in people over 60, this is exactly where misdiagnosis happens. A doctor sees jaundice, suspects gallstones, orders initial tests, and the deeper investigation gets delayed. Weeks pass, sometimes months. This is why you cannot walk into your doctor's office and simply say, "You look yellow." You need to walk in with a complete picture. Dark urine, upper belly pain going to your back, feeling full after barely eating, and now yellowing of the skin or eyes. That combination together tells a completely different story. Do not let any single symptom get treated in isolation. Hit subscribe right now if you are not already here, and do not go anywhere because symptom 5 is the one that has put seniors in the emergency room with a life-threatening event before a single doctor ever connected it to their pancreas. This one has a body count. I want you to think about whether you or someone you know has had a blood clot recently with no obvious explanation, no recent surgery, no long flight, no reason anyone could point to. Because what I am about to tell you changes everything about what that blood clot might have actually meant. Pancreatic cancer releases specific proteins into your bloodstream that fundamentally alter the way your blood behaves. Your blood becomes abnormally eager to clot in places and situations where it never should. The most common place this happens is in the deep veins of your legs. Your calf or thigh swells up. It feels warm. It aches with a dull, heavy pressure that does not go away when you elevate your leg or rest. And here is where it becomes life-threatening. A piece of that clot can break away at any moment and travel through your bloodstream directly into your lungs. Sudden shortness of breath, sharp chest pain that gets worse when you breathe in, a heart rate that spikes without warning. If those 3 things happen together, call 911 immediately. Not your doctor, not urgent care, 911. Research has shown that in a significant number of pancreatic cancer patients, an unexplained blood clot was the very first sign that something was wrong, appearing sometimes 6 months before the cancer was ever found. 6 months. That is how much earlier this disease could have been caught if someone had just connected the clot to the pancreas. If you have had a blood clot recently with no clear explanation, you need to ask your doctor directly whether imaging of your abdomen has been considered. Not as a panic response, but as a responsible next step that could change your outcome entirely. You now know something that most emergency room doctors do not think to tell their senior patients. That connection between a blood clot and your pancreas is the kind of information that saves lives. And the 6th symptom is one your body has already been sending you on a repeating schedule every few days like clockwork. And every single time it showed up, you gave it exactly the wrong explanation. You had a fever last Tuesday. It went away. Then it came back Thursday. You assumed it was a bug going around. It was not a bug. A bug resolves. This keeps cycling back because your immune system is not fighting an infection it can defeat. It is fighting a disease that is not going anywhere. Pancreatic cancer creates constant inflammation inside your body. Your pancreas is inflamed, your bile duct is blocked, bile is backing up into areas it does not belong, and your immune system is responding to all of it simultaneously. The result is a pattern of recurring low-grade fevers that cycle in and out without ever fully resolving. You do not get a high dramatic fever, you get episodes where you suddenly feel intensely cold, chilled to the bone even in a warm room, shivering that comes on without warning, and then, within hours, your temperature climbs low grade, maybe 99 or 100 degrees Fahrenheit. Not high enough to feel truly sick, but persistent enough to feel consistently wrong. And then it passes, and then it comes back 3 days later, and then it passes again. This cycling pattern, combined with night sweats, waking up damp from sweating without being hot when you went to sleep, is one of the combinations that should immediately trigger a deeper investigation. A fever cycling back for weeks with no infection found is not a fever problem. It demands imaging, not just a prescription. Now you know the difference between a recurring bug and a recurring signal. That difference is what gets the right test ordered instead of the wrong prescription. And the seventh symptom is the one that accelerates everything else on this list, because while you have been calling it tiredness, this symptom has been silently dismantling your body from the inside 1 hour at a time. You slept 9 hours last night. You woke up exhausted. You assumed you just did not sleep well. That is not a sleep problem. That is your body being robbed of fuel every single hour by cancer cells biologically programmed to intercept everything your healthy cells need before those cells ever get it. Normal tiredness has a cause you can identify: a bad night of sleep, a physically demanding day, stress, and it has a solution. Rest fixes it. Cancer-related fatigue has no solution. You sleep 8 hours and wake up feeling like you did not sleep at all. You rest all afternoon and stand up feeling exactly as heavy as when you sat down. Simple tasks that were never a problem before, walking to the mailbox, carrying groceries from the car, climbing one flight of stairs, suddenly require effort that feels completely out of proportion to what you are actually doing. Pancreatic cancer cells compete directly with your healthy cells for glucose and nutrients. While your body is trying to fuel your organs, your muscles, your brain, the cancer is intercepting that fuel for its own growth. Your body is running on less than it needs every single hour of every single day, and no amount of sleep compensates for fuel that is being stolen before it ever reaches where it needs to go. The result is an exhaustion that feels different in quality from anything you have experienced before: heavier, more total, more unresponsive to rest. If that description matches what you've been feeling for the past several weeks, the cause deserves investigation, not acceptance. And the eighth symptom is the one I told you about earlier, the one I have seen in nearly every single advanced stage patient I have ever treated, the one that shows up in the bathroom, the one nobody talks about. This is it. Your pancreas produces enzymes specifically designed to break down fat in your food. When a tumor blocks the pancreatic duct, those enzymes cannot reach your small intestine. The fat you eat passes through your digestive system completely undigested, and undigested fat changes your stool in very specific and very recognizable ways. Your stool turns pale, almost gray or clay-colored instead of its normal brown. It becomes greasy with an oily sheen that you can actually see. It floats in a toilet bowl instead of sinking because of the fat content, and it produces a smell that is distinctly more foul than anything you would consider normal. This is not something you ate. This is a direct mechanical signal from your pancreas telling you that a tumor is blocking its ability to function. Alongside this, you will notice nausea, specifically after eating fatty or rich foods, sometimes vomiting, a general feeling of heaviness and discomfort in your abdomen after every meal. And because your body is not absorbing fat, it is also not absorbing the vitamins it needs to function. This accelerates the weight loss, it accelerates the fatigue, it accelerates everything. Pale, greasy, floating, foul-smelling stool that persists for more than 2 weeks demands a phone call to your doctor within 24 hours, not a week from now, tomorrow, now. Before you close this video, I need 60 more seconds of your attention, because what you do in the next 24 hours is the only thing that separates the people who catch this early from the people who do not. If you recognized even 2 of those 8 symptoms while watching this, your next move is the most important health decision you will make this year. Pancreatic cancer is not a death sentence when it is caught early. The survival outcomes for stage 1 are completely different from stage 4, unrecognizably different. The only variable that separates those two outcomes is what a person did in the weeks after their body first started sending signals. Most people waited. Most people called it aging. Most people are no longer here to tell you that was a mistake. You are still in that window, but that window does not stay open. So here is exactly what you do right now. Write down every symptom you recognize during this video. The exact symptom, when it started, how often it happens, whether it is getting worse. Then call your doctor and read that list to them out loud. Do not summarize. Do not say you have been feeling off. Read the list exactly. Specific symptoms get specific investigations. Vague complaints get sent home with nothing. And if your doctor dismisses your concerns without ordering imaging, you have the right to push back. Ask specifically whether a CT scan or an ultrasound of your abdomen is appropriate. You are not being difficult. You are being the only person in that room who is fighting for your life. Do not leave this video and go back to calling it aging. You know too much now to do that. If this video gave you something your doctor has never once mentioned, please hit the like button right now. It takes 1 second and it puts this information in front of another senior who needs it just as badly as you did before you press play. Subscribe if you are not already here. Every single week, I cover the health information that is not making headlines, but is absolutely changing outcomes for people over 60. And share this video tonight. Send it to someone whose back has been bothering them, someone who keeps saying they are fine. You might think you are just sending a video. You might actually be giving them the window they did not know they had. Now, there is something I did not tell you in this video, something I deliberately left out because it deserves its own conversation. There is a specific combination of just 3 of these 8 symptoms that when they appear together does not just suggest pancreatic cancer, it almost confirms it. And there is a single test your doctor can order tomorrow that catches this combination before it reaches stage 2. Most seniors have never heard of it. Most doctors never mention it unless you ask for it by name. That is what the next video covers. It is on your screen right now. Watch it before you do anything.